Hello, hello, my friends. Dr. Pete here from Dr. Pete's office. Let's talk about nosebleeds today, shall we? The medical term for nosebleeds is epistaxis. That's a mouthful. Nosebleeds are not uncommon, but they can cause great anxiety and panic in those who either have them or see them. Where do we bleed from? We bleed from a small plexus of veins called Kieselbach's plexus, located right in the front of the nose. It's a small plexus of veins that, when disrupted in any way, can bleed rather easily. Now, what are the causes of nosebleeds? Well, first, and not in any particular order, picking the nose, very common in toddlers and sometimes bigger kids. Next, nosebleeds can be caused from trauma. So we get a hit in the nose doing sports or just falling down, then that plexus can bleed as well. Third, in places where heat is used, they can get friable and bleed because of that. And of course, this occurs in areas of the country where we're using heat inside the home during the winter months. How do we stop a nosebleed? The easiest way to stop a nosebleed is with your thumb and forefinger clamping the nose and sounding like Donald Duck and holding pressure right here in the front where Kieselbach's plexus lives, holding that nose for 10 minutes, just like this. Mind you, you have to remember to breathe through your mouth. That maneuver, as simple as it seems, should stop any nosebleed. I like to break myths. Here are some common myths. Some folks would tell you to press on the nasal bone up top. Well, that's the nasal bone. The veins aren't up there, so we don't do that. Some folks say lean all the way back, but that's no good because then you'll swallow the blood, become nauseous, and throw up. So we don't want the children or adults to do that either. Simple as squeezing with the thumb and forefinger for 10 minutes. That should stop really any nosebleed. How do we prevent them? One way to prevent nosebleeds is to gently swab Aquaphor ointment or Vaseline with a Q-tip, burying just the amount of the Q-tip and lining the inside of the nose where Kieselbach's plexus lives. That's where we bleed from. At bedtime, we can line the nose, ours or our child's, and it's not obstructive. It doesn't hurt. That moistens the area where that plexus of veins lives and therefore prevents nosebleeds. Finally, if it's recurrent and chronic enough, let's say even weekly nosebleeds, one can visit an ENT surgeon, ear, nose, and throat surgeon, for a little cautery. It's a little cautery. I've actually had it done once, and it's a very simple procedure, the same day in the office. So these veins can be cauterized, and that ends nosebleeds. It's rare to have that cautery procedure a second time. If cauterization is necessary, your pediatrician can refer you to a specialist to do just that. If nosebleeds don't stop bleeding within 10 minutes, or if any other part of the body is bleeding and seems to take a prolonged period of time to stop, then alert your pediatrician, because then he or she can do lab tests to rule out a rare blood disorder that causes prolonged bleeding. But this is uncommon, so please don't worry. So there you have it, my friends. Nosebleeds, small message to you, don't be anxious. Stop them with pressure for 10 minutes. Until next time, take care. Thanks so much for watching, and please share this video with all of your friends. And subscribe to my channel, Dr. Pete's Office, for more fun. See you next time.